Katie, thank you very much. Ladies and gentlemen, I'm privileged to be here today. Those that know me would certainly describe me as an optimist. But on this issue, I must tell you, I'm very frustrated. And we're not nearly where we need to be on this. And there are some some challenges in life where that's understandable. This one is not among them. We should be so much further along. I'm going to give you an update. I was asked to give a federal update, but I will tell you that you've got the right focus for the conference here, seeking solutions. I find one of the frustrations that I have down in Washington is we get sidetracked by ideological debates that are very meaningless when it comes to having impact on people's lives. And this is among those. Even though it's not political, it's in some sense it really is political, but it's not partisan. It's just it's patently unfair what's going on in terms of us, people who live here, and all humans having the ability to say that we are taking all measures to get our arms around this public health scourge and to going forward solving it. So. Let me just say this. The federal involvement, in terms of money, amounts to about $50 million a year. That is a very small figure when you compare that to so many other areas where there are public health scourge. So, on the one hand, we're not putting enough investment into this. Now, we're working to make a difference, and I would tell you that I've worked amendments, appropriations amendments, that has plussed up the account. But if that were the extent of it, then we would still be in a better place than we are today. It's not even the too small amount of money that's put into this. It's the fact that it doesn't get to the right place. If we were to ensure that the roughly 50 million, and incidentally, that's about 9 million in the CDC, the Centers for Disease Control. It's about 28 million in the National Institute for Health, NIH. It's about 4.5 million into the Agricultural Research Service. And Joe Auerbach here today always reminds me it's the tick. Appreciate that focus and attention. We're beginning to move down avenues I think will be helpful there. And about 5 million in what I hope is a new avenue approach, and it's actually in the DoD, in the Congressionally Directed Medical Research Program. And obviously this isn't something that's impacting our servicemen and women as well, so it makes sense that we would, and not for nothing, we've made some of our most important strides in breast cancer research and in other areas actually coming from the DoD. So I want to say that it is true that we're plussing up some of these counts, but the investment is not where it should be, and at least as important, if not more important, is the fact that the right researchers aren't getting access to that funding. So that's going to be part of what I'm going to address in my remarks too. But I want to use the balance of my time. I want to talk about several categories. I want to talk about awareness, education, and prevention as a category. I want to talk about testing as a category, and I want to talk about treatment and healthcare insurance coverage. I'm going to put them together. So I want to cover 3 areas. And the first one is the awareness, education, and prevention. There is some reason for optimism here, including today, talking with John with Elk Creek Custom Blending. But I want to tell you that in my conversation with Dr. Ben Beard, who's with the Centers for Disease Control, we had a very extensive and far-ranging conversation, most of which, candidly, I found unsatisfying. But there were some positive developments that came out of that. The first of which is we're close. We think we're within a couple of years of bringing to market a repellent. And this is a compound Nucotin. Nucotin evidence is like citrus. And it would be in soaps and in lotions and in shampoo. And it would help repel the tick, and it would also, in the first 24 hours, kill a tick that may be on the body. So, in terms of prevention, I think that that's important. And then other aspects of this, in the Farm Bill, is when we opened up, or at least expanded this front in the Ag Research Service, and the purpose of which is to try to get more awareness, more research and awareness of the impacts of changing weather patterns and how that has exacerbated our situation with tick-borne diseases. We are fortunate, like in many areas of this public health scourge, some of the very smartest, best, most accomplished professionals come from our area. Now, at the one hand, we can be enormously proud of that. On the other hand, it makes sense, right, from a pragmatic standpoint, because we're really the part of the country that's most viciously attacked by this disease. So, but Dr. Osfeld from the Carey Institute, I think has had some incredibly helpful research on this score, and so he is going to have access to this funding stream now through the Ag Research Service. Just before we assembled here, I met John. Well, I'm seeing him for the second time. John, he's actually from Otsego County. We appreciate him driving down here today from Milford. But I want to illustrate the point, because I'm saying there's some reason for encouragement when it comes for awareness, education, and prevention. Here's somebody who, through some common sense approaches to the land, has got an organic approach to fertilizer that in its initial fielding in Dutchess County, I think he said it was his cousin that was in Dutchess County. They've had a number of farms that went from a proliferation of ticks to virtually none. So, and the good news is John is working with the University of Rhode Island, and so there's a cooperation and collaboration going on there, and we have some funding streams now because their challenge is access to funding. So we can help on that, and I'm glad to make that acquaintance. The third thing is I will tell you this, that the county health departments that I've worked with, especially in Dutchess and in Columbia County, are trying to do a better job about getting the word out about good tactics, techniques, and procedures, as we used to call it, of how to prevent or protect yourself from tick-borne diseases. And then I also want to mention that what has been encouraging is the level of media attention we're getting. It's better than it was. We have Mary Beth Pfeiffer to thank, but there's more. But I mean, Mary Beth has been on this issue. She's actually with us today. We appreciate her vigilance on the issue. She's got a long record of looking at issues that really are surrounding injustice. And I would put this right in there with them. And so she's been nominated for a Pulitzer Prize, and I think that that's important. But also John Farrell with the POJO has done some research on this. Carrie Allen and Katie Kolchak from Columbia County have written on this topic. And even Benita Zahn, who's a TV personality up in the Capital District area. Why this is important is the more light that we can shine on this, and particularly the frustrations that we have and the challenges, the better chances we have of getting a change in what's going on. So that's the first category of awareness, education, and prevention. Testing. So there have been some investments on testing, and we've done hearing on that on Capitol Hill, where we've heard from an Abbott PhD researcher. The challenge, of course, that we have now is the spirochete is, it's pernicious. The spirochete can be latent, it can hide in the body. We're drawing blood from the body to see whether or not the body's fighting the spirochete, and there's several issues with that. And part of it is that you don't see it right away. And we know, bless you, the challenge we have is that while we know the medical community is divided, sadly and tragically and wrongly, we do know this, that the medical community is united, that the sooner that we get a diagnosis, the better chance of full recovery. So that's why testing is so critically important. There are some reasons for some optimism. The Poughkeepsie Journal, Mary Beth did a story, you may have been following it, that we have now, it appears, close, a test from Europe. And, there are some aspects about how Europe is addressing this particular public health scourge that we can learn from and do better on. But, this test actually draws the blood and looks at protein levels. And why this is important is that it's able to zero in on prior to and then after any kind of infection. We've got a better chance of picking up whether or not someone has Lyme, tick-borne diseases. I don't have a lot of good news here. While there's room for encouragement in terms of education, awareness, and prevention, and with testing, the treatment has just been enormously frustrating. And my assessment is this, that while you could point to a lot of different things about this area, I think that the guidelines that come out of the Centers for Disease Control is the proximate cause of the challenge. Because doctors live very busy lives, they're so incredibly stressed, 100-hour days, and they're spread so thin that when it comes to being Lyme literate, they just don't get access to the latest research. That's number one. Number two is that when we do have doctors, like in our area, that are making a difference, that are treating people, they're loath to send in the information. We don't have a repository of the experimental successes, because they know if they do, they expose themselves to litigation or potential, charges. So this is not good at all. And I put the treatment together with healthcare insurance coverage, because even where we've had successes in our area, where we've had experimental treatment and we've had folks get well, it is depleted in many cases their life savings, and in some cases put people in debt. Not uncommon to be over $1,000 for a particular visit. And so when I pressure the insurance companies, what's going on with this? What they tell me is, well, we pay for it if it was approved care. Well, see, we're back to the guidelines again. Now, we have a policy in our country that each of these guidelines that are posted on the clearinghouse are supposed to be reviewed every 5 years. Now, we've been almost 8 years without an update to our guidelines as it relates to tick-borne diseases. And when this is what was the catalyst for my conference call with Dr. Beard from the CDC. Now, we went back and forth on this, and what he has said to me is this. We're at this standoff where he says, look, if the research pointed to the need for a change, then we'd substantively change it. And this is where I come back in and say, look, you're taking a virtuous process and you're making it non-virtuous. We have this system of we decide, and it's the same with academia, whether or not your paper gets published, it's sent out and anonymously reviewed, and it's meant to be virtuous because it's supposed to take the politics out of things. But that's not, it's exactly the opposite in this case. Because when the papers that show the chronic Lyme suffers, and it shows the connections, when that's farmed out for review, well, it gets the thumbs down. And we don't even know who turned it down. So, when Dr. Beard, God bless him, when he's saying, well, the research isn't pointing to it, I said, there's all kinds of research out there. And now there is, the one thing that I will tell you that since that call that's been encouraging is Dr. Horowitz's book moved to in the top 10 of the science portion of the New York Times bestseller list. Why can't I get better? So we are getting the word out on this. But, I think that, so what have I done on the guidelines? I've written a letter to try to change it. I did have several members that come with me, but to be candid with you, I was underwhelmed by how many of my colleagues I was able to get to come with me. Dr. Blumenthal did come on the letter, and we did have Chris Smith, who's been a long advocate in this area. Frank Wolf came on the letter as well, and that was it. There were 4 of us, but we're not going to rest on this. We're going to keep working at trying to change the guidelines. So what are we going to do then? Because I think seeking solutions, and I'm getting close to moving to the Q&A here. So in addition to ensuring that we keep funding streams as plussed up as we can, and I acknowledged earlier we could do so much better on that. We've got a bill we've been in consultations with the committee and with advocates from the community, and we are soon to introduce this bill, and we think it's going to have bipartisan support. We know it will. Joe Courtney from Connecticut will be on the bill with me, Democrat from Connecticut. We'll also have Peter Welch, Democrat from Vermont, will be on the bill, and then Chris Smith is going to be an original on this bill, and so will Frank Wolf, the 5 of us. And what this bill is going to do is it's going to direct the national, it's got 2 basic points. It's going to direct the National Institute of Health to come up with a plan to deal with vector-borne diseases, including tick-borne diseases, and specifically targeting chronic diseases. And so it directs the NIH to have a plan, including identifying gaps and strategies to resource those gaps. Now, we've heard this before, So I would tell you that's not the big move in the bill, although it's very important. The second piece of this is that we're actually going to have, for chronic diseases, including chronic Lyme, we are going to have a working group established, including Congress getting to direct who sits on the working group. And as the author of the bill, I'm expecting that I'm going to have pivot steer in terms of who gets to be on this work group. Now, the work group is in the language, there's explicit language for patient advocates and the medical professionals who support our patient advocates. This is the key move. We've got to get a seat at the table so that when whatever resources are available for us to put into this area, that it goes to the right places. And this, I think, will help us, turn the tide. And so whether it be the environmental piece and attacking directly the ticks, or taking other measures in terms of awareness and education, including prevention and the repellent that we're looking to bring forward, the testing, so important to an early diagnosis that will lead to effective treatment, or more broader treatment and healthcare insurance coverage. I think the next big step is getting our patient advocates a seat at the table. And I think that, to me, I know that that's where, I was not an expert at Lyme at all when I came home from the Army. But it seemed like there didn't go a week that I wasn't, at least several times in that week, that I didn't hear from folks who have been tragically impacted by this. All of us. Everyone in the room here obviously is passionately involved in the issue, but even when you go out into our communities, we know there's one degree of separation between us and people seriously suffering from this. And we need to get those voices heard. And I think that's when we'll start to, and by the way, some of these same approaches is what helped us get a much better place with AIDS, is when we had this kind of focus. And that's what we're trying to do when it comes to tick-borne diseases. So my report to you on the federal piece of this is mixed. There's some reason for optimism, but there's other reasons for us to continue to stay highly mobilized and energized going forward. Yes, ma'am?
Are you able to pinpoint for us more specifically where the opposition seems to be really coming from? Because the fact that 4 brave souls in Washington are doing this passionately, there must be something very strong there that stops you from doing what you're trying to do, because otherwise people should be open-minded, and it doesn't sound like it. It sounds like you're hitting a brick wall. We'd like to know where that lobbying is coming from.
Well, look, we all know what the conversation's about. And we've seen it recently. This bill that I'm talking about, we worked with Chris Smith and Frank Wolf and with Joe Courtney and Peter Welch. The first addressing of it was going to come through H.R. 610, which we initially got stuffed by the committee. So we're trying to reattack, if you will. We're trying to come back at the same issue, trying to get the same objectives done. But we wouldn't even be having the conversation about that had we just been able to pass 610. So, the resistance is real, and we're going to find out when we get votes on this, and it'll be interesting to see where the lobbying goes in. I don't want to detract too far from this point, but I'm working broadband as well, and I've only lost 2 votes since I've been into Congress. I lost 1 vote on the floor on Syria, which we ended up winning in the end, because we had onerous language in the DOD approach bill, authorization bill, that was essentially, to me, what was tantamount to moving towards war with Syria. I tried to strip it out, and in the end, in the conference, we did strip it out, but I lost the vote on the floor. And then the other vote I lost was in committee to expand a broadband program. And what I noticed is the big companies lobbied hard against my amendment, because we had defeated them in 2011. We had actually reversed, my House leadership was going to zero out the low-interest loan program, and even though I'd only been in the Congress 6 months, I brought an amendment to the floor and won and reversed my leadership. And the big companies, their after-action view was they were caught sleeping. So on the one hand, it was good that we survived the program, but they going forward, now they're targeting me. And they beat back my amendment in the committee of the Agricultural Committee. What I'm going to be curious to see is when we bring this bill, which we think has tremendous promise, you know, what the resistance is going to be. So we're going to know more. I mean, other than that, I would just be repeating what you already heard in our conversations as to where the resistance is. And at this point, I want to stay focused on getting this across the line. Joe?
Hi, I'm just wondering if we could convince the insurance companies how much money this chronic disease is really costing them in terms of real dollars, and finally get them behind us at promoting doing something about the disease.
Well, you're exactly right. And, you know, as for some, you may remember, we did a forum at Skidmore, going back to 12. And there were those that said, there's no way insurance companies are going to come to your forum. And I worked really hard. I said, you know, we need you to be there. And they're like, the last time we did this in Connecticut, it really ended poorly and everything else. I said, you've got to be here, though. We need your voice involved. Now, they did come that day. And I would think you would join me that we were less than satisfied with what they said. But I think it was important that they at least were there. So we have to stay engaged. And to just illustrate your point, Joe, this gentleman here, John, who's here today, where are you, John? John back there. So let me give you an example. If this ends up being, let's just say for a moment, for the sake of argument, that the work that John's doing with organic fertilizer, let's just say that through all the testing, it ends up being efficacious, and that it can work, and that it can be scaled. Okay? Why wouldn't the insurance companies want to help? I mean, we're talking about saving billions of dollars in treatment by just addressing the environmental piece of this in front of. So I would think that the argument sells itself here if we can get more exposure. I actually, my assessment, and I'm open to your thoughts, I think the biggest problem is just getting enough attention on how prevalent and how pernicious this disease is and why we have to attack it as we do. Yes?
Yeah, so, you know, if you just take, there's been an estimation that Lyme disease costs $10,000 per case. Now you've got 300,000 people that the CDC admits in the United States. So what is that? I will math $3 billion or something?
A lot.
Yeah. That it's costing the insurance companies a year.
Well, and especially, so that's why, you know, I think we have to, as I closed, I said, we need to stay mobilized and continue to pressure. Because I do think that once I call it the light of day test, I think when we can get all this information out, the public's going to be with us. They're going to say, why would you block this? Why would you stand in the way of this? So I think we need to continue on this course.
We have mics for anyone else who would like to ask questions, because we want to make sure that our audience can actually hear the whole question. So any questions on this side of the room? No? How about that side? Chris, I think, has the mic there. Okay, there's one. Let's get you a mic so we can all hear the question.
Yeah, Congressman, a great speech, by the way. That was very informative. We're students at New Paltz. My name is John Kerr. We've been learning about Lyme all semester, and we got press passes to attend, but I really like what you're saying. And I was wondering in particular, I've been learning a lot about biofilms, and just specifically, you know, have you heard anything about that? It has to do with the Dr. Alan McDonald. He might be one of the researchers that you said was more deserving of funding. Or
candidly, I have more to read on that, but this is why I think more than anything else, what I want to do as a representative is be a voice, is to not just be a voice, but to seek solutions. So on this committee, that, you know, we get this thing through, and now we're at the point of forming the task force, is that we get the advocates together, and I know Pat Smith will be involved as well, but we figure out who do we want to get that's going to be at the table when we're making decisions on where the money goes. That's the best thing that I can do. In terms of Dr. McDonald, I'm just going to have to read more about. I don't know enough to comment on the subject. Yeah.
Hello, and thank you. That was an excellent presentation. My name is Sarah, and I'm an expert on Lyme because I've had it for 25 years, and I'm all the other supporting and I've been through the mill of allopathic.
Can't
alternative.
hear you.
Oh,
Hold it
Is it on?
to your mouth.
okay. Well, anyway, so I understand, I have so much to say, but I'll try to narrow it down. You mentioned how physicians are very busy people, understandably, but since Ulster and Dutchess County are endemic in the United States, I'm amazed at, I was wondering how many local physicians are even in this audience, amazed at the lack of help and knowledge that most of them have, and also the local infectious disease doctors are in that other camp. So people are suffering. People call me for advice, and it's not right. And so I wish there was a way of demanding, if you will, that the doctors in endemic areas would at least be forced to read a book or go online on a proper website, so that they have a little more education, rather than saying, I don't treat Lyme, go somewhere, or let's wait for the blood test when you walk in with a tick or a bullseye rash and say, that doesn't look like a Lyme rash. Oh, so one question is, I have called, they do a lot of research at Columbia Presbyterian, John Fallon. I have called there and saying, why don't you open a clinic in this area rather than doing all your research in New York City? And I don't get an answer, so my question to you is, could someone possibly do that? Because this is the area where we need a clinic.
Yeah.
And
No, I think that's a great recommendation. What we do have to date is we have practitioners. We do have, and Doc's going to be giving a presentation here in just a little bit. So we do have some repository of experience and knowledge that we should fleet up, because this is becoming a national issue. The problem is we haven't got saliency politically, but I've seen the charts. You've probably seen it, the prevalence, and if you look at it over the last 5-10 years, the number of cases is spreading. Obviously, we're dealing with it very, very difficultly here, but I mean, you're seeing the number of cases in all states now increasing, and in some parts of the country, like the upper Midwest, and even parts of California, it's spreading at a pretty rapid pace. So I think we're going to get more saliency. I will tell you that part of, what I think part of the challenge is just how underreported tick-borne diseases are. Holly Ahern, who you probably have seen a presentation at some point from her, she estimates that only 10% of the cases actually get reported. So I think once we can get that information more mainstream known, I think that that's going to put us in a stronger position to do just as you're saying, which is, doctors, general practitioners deal with a whole series of competencies before they come out, and this is going to have to be, if you're coming to the Northeast, particularly, but really anywhere, but particularly in the Northeast, you should be Lyme literate. I mean, I want to say this, that what I'm hopeful for, in addition to some of the other things I mentioned, is when you look at Doc Horowitz's book, I think there's the potential to bring the medical community back together. Potential. And here's why. Those that deny the existence of chronic Lyme, that they have been saying, it's not Lyme and everything. And one of the things that Dr. Horowitz showed is the prevalence of co-infections. So, to me, I just want to see the community back together and to put their focus on service and helping get people get better. If that can give them face saving to say, well, it was co-infections, I could care less about what it takes to get them back in the community so much as that they come back. We've got to find a way to get the entire medical community to be involved here because our folks are suffering. I mean, it's just, so there's that.
We have time for one more question. Hi, my name is Tina, and I work at an environmental education center in Wappingers. I have a prescription in my pocketbook for Lyme, to be tested for Lyme, and my brother's had disease for the past 20 years. What can I do as a single person? I've heard you say frustrating for the whole time, 3 times. What can I do?
Yeah, it's great. Tina, what I would tell you is that we should just put our focus on, most immediately, we should get our bill passed. the bill that's going to get patient advocates to the table. That's the most important thing we can do right now together. So while we look to get it across the House floor in the next month or two, then to get it across the Senate floor, and then to have the President sign it, that's the most important thing we can do, because then we can have a strategy session about who we want to be at that table, and then I think we can start to get better.
Congressman, where can we find information about that bill?
Yeah, so we're going to get it out. Jill's going to have a copy of it either by today or tomorrow, and then she can get it out to the entire community.
Wonderful.
Okay?
Please sign and give us your email so we can get it out to you. If you haven't signed, please do sign.
Exactly.
Thank you.
I'm going to be asking people to help, if they're willing to sign up, give us your name, your address, not your email address, so that we can contact you, so that you can help get not just this passed, but in New York State, we have some bills that need passing to allow patients to have a choice in their physicians that they see.
We just have the most wonderful congressman. He has been such a champion for this issue. We are so grateful to you. Everywhere I have looked where people are trying to get more educated and learn more about Lyme disease, your name comes up as our true champion on this issue. Thank you so much for coming.